Okay, so you already saw part of this tissue in the histology chapter, but we're going to look a little bit deeper into the structure of bones and bone tissue. So some of the learning objectives are to describe the major functions of the skeletal system, to be able to identify the differences between compact and spongy bone, also distinguish between the three types of cartilage, and describe the role of dense, regular, and irregular connective tissue in the skeletal system. And we are also going to classify the bones according to shape, to length, and according to location. We're going to see how we can classify them according to location. And we are going to see as well how bone tissue is formed, how it grows, repair, and remodel. And we're going to see what hormones play a role in the physiology of bone. So, bones, if you remember, they have blood vessels. And these blood vessels that reaches into bone carry oxygen, nutrients, water, hormones, and anything that the bones needs. Now, the arteries that goes into these bones are called the nutrient arteries because they provide nutrients. And they go into specific areas of the bones. But the little hole where these nutrient arteries enters into the bone are called the nutrient foramina. And then these bones, because they have a lot of blood supply, they are considered highly vascular. So vascular refers to blood supply. So a major contrast between the tissue of the bones and the cartilage is that bones are vascular. Then in contrast, a vascular means that you don't have blood vessels. So, cartilage doesn't have blood vessels, so it's a vascular. Bone has blood vessels. And the covering of the bone, which is the periosteum, it is the point of entry of also some nerves that innervates this periosteum or this membrane. So because you have nerves, this tissue is also highly innervated. So innervation refers to having nerves And in this case, bone tissue is highly innervated, so meaning that it has many nerves. And these nerves provide a specific function to the tissue, depending on the tissue. In the case of the bones, it provides function to know exactly what forces goes into the bones, in what direction, in order to respond by directing that force in a particular area. Some nerves are sensory, so meaning that they provide sensation. In the case of the nerves for the bones that are located in the periosteum, it helps for sensing pain. If you have hit your chin, there is no muscle that covers the shin area. It's only skin and subcutaneous tissue. But if you have hit it, it doesn't feel funny. It feels so painful. It's because you're hitting directly the periosteum. You are activating the nerves for pain, and that's how you feel the pain. So that's a sensory nerve. Other nerves help us to move, muscle, like those will be motor nerves. If a person get a disease where the nerves will be affected, like polio, then the person will lose motor function. He won't be able to contract that muscle. Okay? And then the property or the function that these nerves gives is called innervation, or the contact of nerves to tissue is called innervation. So, then the bones have a lot of blood supply with the blood vessels, a lot of nerves, and they are living organs. They are made of specialized cells. We will see the names of these cells. And they have as well a mineralized extracellular matrix. Remember, extracellular matrix will be the space that surrounds, or the structure that surrounds the cells. So this surrounding of these cells is mineralized with calcium salts. So that's why bone is rigid. Functions of bone tissue would be to provide a structural support. So then our muscles will be able to attach into the bones because it provides a structural support. It's like a column in a wall. It provides a structural support. And then it protects vital organs. You already know that from chapter 1. The skull, the cranial cavity with the bones protects the brain. The vertebrae protects the spinal cord. The rib cage protects the heart, the lungs, and the great blood vessels. So they provide protection to vital organs and enable the movement through joints. I mean, why we have many bones? Why we don't have just very few? Well, because we have to have points of contact between the bones so that bones can slide over each other in the case of the bones that we have in our limbs. Not precisely sliding like this, like they have to move between them. That's a joint. It's like a hinge in a door so that you can perform movements. Okay, that's why we have these joints and these bones. And then bone formation, growth, remodeling, repair allow the adaptation to physiological and mechanical demands throughout life. Maybe you have heard this before. If you want to have healthy bones, you're supposed to move. You're supposed to do exercise. Especially, it is recommended within the limits, of course. Not everyone is going to be a bodybuilder, but weight-bearing exercises produces certain stress in the bones that makes the bone cells to grow a little bit better and healthier. So healthy bones are given by not only nutrition, but also by doing exercise. So we are going to see in this chapter then how cells form tissue of the bone and how all of this contributes to health and mobility. So what are the four major functions of the bone? What are the major functions of the bone tissue? Well, it will be to provide support and structures to the body. We saw this before. Protecting internal organs, so this is a summary of what we saw. Facilitating movement and point of attachment for the muscles. And as well as storing minerals like calcium and phosphate. The major deposit of calcium in our body is in the bones. We still have in our teeth, but also we have it in bones. And then bones, internally, the long bones have a cavity that's called a marrow. And within this marrow, red marrow, you produce blood cells. So bones are in charge of hematopoiesis. That's the name for bone cell production, blood cell production, sorry. If I keep saying bone cell production, you are wrong, it's blood cell production. So hematopoiesis is given by the bones in the red marrow, or you can store fat in the bone marrow. In this case, it's going to be called yellow marrow, and as well participate in acid-base balance. Let's see, I might have left the marker there. So acid-base balance refers to the equilibrium or maintaining normal levels of hydrogen in our body, hydrogen ions. Because with these hydrogen ions, you have normal functioning of enzymes in our body that help us to have metabolism, a specific metabolism levels. So here is the summary of the functions: protection of vital organs like the brain, in this case is the skull protecting the brain, and then a storage of calcium and phosphate, and then production of blood cells in the marrow, red marrow, or storage of fat in the yellow marrow, and then movement and point of attachment for muscles. So this is an articulation, like this is the knee joint, and here we have some of these calf muscles, and then support. Ultimately, all the weight of our body, when we are standing, goes into the heel and into these bones here that we call the metatarsus. That's the point of contact with the floor. Okay? So it supports our body as well, the bone tissue. So microscopic components of the bone tissue. So we have cells that are immature, that are called osteoblasts. They build the bone matrix. We have mature cells that are called osteocytes that maintains the bone matrix. And then we have cells that recycles this bone matrix. Are the osteoclasts. The osteoclasts are large cells because they come from fusion of multiple cells. And actually they are multinucleated. They have more than one nucleus. While the other ones, osteocytes and osteoblasts, they only have one nucleus. I think I told you this before, but anytime that you hear the suffix blast, in biology, that means immature. So here you go. This is the ending for osteoblast, so it's an immature cell of bone. Osteo means bone. And then osteocyte, well, cyte means cell, so it's the cell of the bone. Clast might mean reabsorbing. Just check on that. And here is a view of some of these cells, how they form. So if you magnify an area of the bone where you have here the periosteum, and then these are the collagen fibers from the periosteum, you have an outer layer and an inner layer of the periosteum. In the outer layer, you have these cells that are called osteogenic cells. Genesis is formation, so these are the cells that forms bone, osteogenesis, or origin, okay? So these osteogenic cells will mature, so they will become less immature, so they will mature, and then this process is known as differentiation, so they become osteoblasts. So these are the osteoblasts. And then these osteoblasts, they take a more mature shape. In this case, they start secreting bone matrix. And this bone matrix is called osteoid. It's like a mixture of calcium salts, is hydroxyapatite, and this matrix, as it's being built up, is going to trap this osteoblast. And when it gets trapped in the matrix, this osteoblast, now it will become a mature cell. So notice how these cells were flat initially, they become larger, like almost cuboidal, and then they created some ruffled borders. And then as they secrete this matrix, they become trapped, they differentiate now into osteocytes. So the osteocytes will have like a star shape. They have a nucleus that is smaller than this previous cell, which it was less differentiated. And then these cytoplasmic extensions, they use them to connect to other osteocytes through the canaliculi, through these little channels in the bone tissue. And all of this helps to transfer signals. like it can be chemical signals, physical signals, and then they can either share nutrients, all these cells, through these connections. And these extensions are surrounded by this matrix, calcified matrix. So now, this space specifically where these osteocytes are located is called lacunae or lacuna, which means little lake. So it's the space where the osteocytes are located. So then the differentiation starts with osteoprogenitor cells or osteogenic cells into osteoblasts and then into osteocytes. So let me write it here. So this is how the bone cells differentiate. So from osteogenic to osteoblast to osteocyte. From immature to more mature. Think about stages of life for us, for humans. We start as babies, then child, adolescent, young adult, middle-aged adult, older adult, and then elderly. So that's how it goes. From less mature to more mature. Okay? Now this cell that you see here in this slide is the osteoclast. So this osteoclast is actually the cell that reabsorbs bone. It's not shown in here, but multiple macrophages, which are gigantic cells that can eat debris, among other things, fuse, and they form a single cell. So this single cell is called osteoclast, and it has ruffle borders, and it has multiple nuclei, as you can see. And they secrete, if you magnify this part in here from this osteoclast, they secrete enzymes and hydrogen so that you can degrade this extracellular matrix. So then after you degrade this extracellular matrix, you release calcium, phosphate, sugar, and amino acids. So your bones become weaker with overactivity of these osteoclasts. So then if multiple macrophages forms an osteoclast and they leave their nucleus there, how many macrophages had made this osteoclast if the purple spheres represents one macrophage? How many nuclei do you see there? How many? Do it with your hands. How many? Both hands, you need both hands. How many nuclei, how many purple spheres do you see there? 9. So it's made out of 9 cells. So this osteoclast in particular, it was made by 9 cells. So then we have here what happens with the formation of bone. Sometimes you can deposit bone tissue, sometimes you need to reabsorb. Our bones are subject to different forces, and based on that, it is where you can absorb bone, where you can deposit bone. And this is seen this way. So here we have the osteoblasts depositing bone. So these are, remember, the cells that makes the matrix. And then the osteocytes form after this matrix was deposited, so this maintain the matrix. But then when you need to remodel the bone, you start breaking it away with these osteoclasts. So this actually is the principle for braces. Remember, our teeth are embedded within the jaw bones. And then with these braces, when they apply force in a particular region and they don't apply as much into other region, that's what they're trying to remodel the bone in there so that you can realign your teeth. Maybe part of the alignment is needed to have bone reabsorption in an area that is pushing your teeth possibly in this direction. So internally, you might need more reabsorption of bone. So you might apply less pressure than in the other direction. I mean, people who do orthodontics, they know this, but that's what is happening. You are playing with physical forces to increase reabsorption or to allow bone deposition so that the teeth stays in place. So now let's look at the components of the matrix. So we saw the cells. Cells of bone are osteoclasts, osteoblasts, osteocytes, and osteogenic cells. Now, the bone matrix, which is the surrounding of the cells, is made out of 2 components, an organic matrix and an inorganic matrix. So the organic matrix is also known as osteoid, and that's where you have collagen fibers, which is type 1 collagen. This type 1 collagen, it helps to provide tensile strength and flexibility. So it's a flexible type of collagen. And then we have not only collagen type 1 in the matrix, but we also have proteoglycans and glycoproteins that helps to absorb water and bind water to give support to the matrix structure. And this matrix, it is made by the osteoblast. So, with this osteoid or this matrix, your bones resist twisting and stretching forces, preventing brittleness. That's the organic matrix. It's called organic matrix because you have collagen fibers, which has amino acids with carbon and hydrogen, and among other things. Now, the inorganic matrix, it has calcium calcium salts that helps to make the bone to be strong, while the organic matrix makes the bones to be flexible. So, components of the inorganic matrix, mainly hydroxyapatite crystals. So this is the chemical formula. Calcium 10, phosphate 6, hydroxyl 2. So you have 10 atoms of calcium, 6 of phosphate, 6 molecules of phosphate, and 2 hydroxyls. Inorganic because you don't have carbon and hydrogen binding. And then this inorganic matrix helps for the bone to be hard and resistant to compression. So I told you before that when we start forming in utero or skeleton, it's first made out of cartilage, hyaline cartilage. And this hyaline cartilage undergo different changes, and one of it is ossification or calcification. So all of these proteins that make the cartilage become ossified by depositing these calcium crystals, hydroxyapatite. That's the main form. And that is what it gives the bones the rigidity, the structure. But we still have an organic matrix, the osteoid, made of collagen fibers, that makes our bones to be flexible and to have some cycling between the collagen, the osteoid, the organic matrix, and the inorganic matrix for remodeling. Not all the times we ingest the levels of calcium in our diet that we require per day. And what do? Then in that case, you reabsorb this calcium from your bones, you use your osteoclast, you release that calcium into your bloodstream, and then once you ingest calcium, you deposit back that calcium into your bones. But what else do you have there? Well, you have the osteoid to be calcified with this calcium that you absorb in your diet. If someone changes jobs, or the person maybe is laid off for a while, and if he had money in the bank, what is going to do? Get money from the bank to keep paying for the bills, getting food. So basically our bank of calcium is in our bones. So here are examples of some bone disorders, bone matrix disorders. So this is normal bones. These specifically are the fibula. The fibula are located here in our legs, lateral portion. Are very thin bones that we have it in there. And then if you remove the organic matrix, if you remove the collagen fibers and you leave only calcium, look at what happens to this bone. It shatters. It's very brittle because you remove the flexible portion, the osteoid, the organic matrix. So now, if you remove the inorganic matrix, the calcium, and you have only collagen fibers, look how this bone bends. It's so flexible. So this is combination of both the organic and inorganic matrix. So you have calcium and you have collagen. In here you have only calcium, so the bone breaks because it's very hard. And in here you have only collagen, so the bones are very flexible. So both of these situations are not good. We have a disease that is called osteomalacia in adults, and in children it's called crickets. And that's the lack of vitamin D. So So we need to have vitamin D in order to absorb calcium. If you don't have calcium in your bone, you will have only collagen fibers, or your bone will bow. I will try to search for an image of that, but basically, I mean, some of us maybe have a little bit of bow leg type situation, but I mean, kind of a very exaggerated form will be like this. So you'll be bow leg. Why? Because the bones are supposed to be a little bit rigid so that you can support your weight, but with all that weight, with that calcium, the collagen is going to bend like this, just like as you see in the bottom panel. So that's osteomalacia. And then if you have problems of collagen, like if you don't have enough collagen, then you end up with brittle bones. It's like the character of someone, guys. You cannot be too rigid because you will get in a lot of trouble, and you cannot be also very flexible, saying yes all the time. You have to sometimes say yes. You have to be flexible sometimes you be firm. And that is helpful for everyone and for you. Any questions about this? So bone health, as you can see, it's important. Okay? So then, what is the remodeling process of bone tissue and what is its function? So basically, bone remodeling is depositing bone and reabsorbing bone as is needed, and this helps to maintain the strength of the bones and mineral balance. Well, what happens if you have excess of calcium? In this case, in your diet, you don't absorb it, you eliminate it through the urine, and then you maintain a specific amounts of calcium in your bones. So you have to maintain a mineral balance. So that it's given by bone reabsorption by the osteoclast that breaks down the bone matrix, as you saw before, by secreting acids and enzymes. that releases calcium and phosphate into the bloodstream. And actually, this phosphate can act as a buffer. It can help to absorb hydrogen ions to maintain acid-base balance. That's your link. And then bone formation. Well, if you have a good diet of calcium, but also amino acids, you start forming collagen fibers that makes your bones to be flexible when needed, especially when you're doing exercise. So that helps to restore bone strength because you have to have the osteoid to mineralize the bone. If you don't have collagen fibers, then what are you going to mineralize? So here are some requirements for bone formation. You require proteins to make the collagen fibers, calcium and phosphate to mineralize these collagen fibers. You need vitamin D to absorb the calcium, and you need vitamin C to hydroxylate the collagen. So these are nutritional requirements. So in bone maintenance, you have the osteocytes sensing mechanical stretch and micro damage. So again, that's when you do exercise and then you fortify your bones. And then that requires balance between the activity of both osteoblasts and osteoclasts. So now let's look at the classification of the bones. So by shape, you classify the bones as long, short, flat, irregular, and sesamoid. Long bones are taller than wider. They have a middle part that is called a shaft and two endings that are called epiphyses. Examples of long bones will be the longest bone in our body, which is the femur, the bone of the thigh, and the bone of the arm, which is the humerus. But with the exception of the bones in the carpal area and the bones in the tarsal area, all the bones in our limbs are long. And then the short bones are cube-shaped because they have equal width and length. Examples of short bones will be carpals and tarsals. We will see the individual names of these bones later on. And then you have flat bones that are thin, they're flattened. They're not, don't think they're perfectly flat, they can have a curve. And examples will be the bones that we have in the skull and the scapula, which is this bone that we have here, or the sternum, which is this bone that we have here. So here, here, and here we have flat bones. And then bones that are not flat, that are not short, that are not long will be irregular. They don't fit into the previous categories. So examples of irregular bones will be the vertebrae, which we have in the spinal area here, and then the pelvic bones, which are here. Now, the proper name of the pelvic bones will be coxal. And I'm going to start pointing it right away because we will be looking at that every time. Pelvic is a colloquial name, but the anatomical name is coxal. And then sesamoid bones are bones that forms within tendons. Tendons are strings of collagen fibers that binds muscles to bone. And in the case of the only bones that are sesamoid, classified as sesamoid, that we count as the number of bones that we have in our body will be the patella, which is the kneecap. So those are sesamoid. And then we have also sesamoid at the base of our thumb and also of our great toe. And they vary in number, so we don't count them, and they don't have a specific name, so we don't count them as part of the bones from the total number that we have in our body. So that's the bone classification by shape. Do you have any questions? Okay, so here is a view of all of these bones, the classification. So this is a long bone. This is the humerus, is the bone of the arm. And then here we have one of these carpal bones. So this is a short bone. And then here we have what some people refer to as breastbone. So this is the sternum. This is a flat bone. And then here we have a vertebrae. This is in the spinal column. So this is an irregular bone. And then the kneecap bone, it is called the patella. This is a sesamoid. So long, short, flat, irregular, and sesamoid. That's the classification by shape. Now, long bones have parts. So let's look at the parts of the long bone. The middle part of the long bone is called a shaft. And then the long bones on the sides of the shaft have endings. These endings are called epiphyses. So the ending of the bone that is closer to the point of origin will be the proximal epiphysis, while the ending of the bone that is away from the point of origin will be the distal epiphysis. Another name for the middle part of the long bone is also known as diaphysis or body. So you have three names for that middle part: diaphysis, body, or shaft. And then in between the diaphysis and the epiphysis, you have a region that you call metaphysis. And then In young growing bones, you have a pad of cartilage that is called the epiphyseal plate. And when you stop growing, you replace this plate, this cartilage, by a line. And this line is going to be called epiphyseal line. Our bones have different times when they stop growing. And these bones can be useful, these long bones, to calculate more or less, and not only the long bones but other bones, they can be useful to calculate the age of a person just by looking at x-rays or an image of these bones. Even the thickness of the cartilage, the plate, the epiphyseal plate, can tell you the age of the person. And it's approximate. So these type of studies are useful in forensics. Let's say that a house burned and then there was some family members that were there and all you have is the remainings. And you take an x-ray of the skeleton. Well, you can tell, well, this person was approximately this age because of this. And then in the middle of this body shaft, internally, you have a cavity that is called the medullary cavity of marrow. Now, the bones are surrounded by a membrane that is called the periosteum. And then this periosteum is hauled into the bone by perforating fibers that we call Charpais fibers, which are nothing else but collagen fibers attaching this periosteum into the bone. And then the internal cavity, which is the medullary cavity, is surrounded by this membrane that we call endosteum. And now, the endings of these bones, whether it's the proximal or the distal epiphysis, has a pad of cartilage that we call the articular cartilage, which is hyaline cartilage. And this helps to protect the bones in joints against friction. Because bone-to-bone contact itself in a movable part, in a movable articulation, it makes the bones to erode. In persons who have osteoarthritis or rheumatoid arthritis, this pad of cartilage wear, and then the person will have deformities of the bones because they have bone-to-bone contact. So you have to have a little pad of cartilage to prevent friction. So here are the structures of long bones. So this is the closed view of the bone. This is the open view. So this little part is the shaft, which we also know as diaphysis or body. And this will be the epiphysis. So this is the proximal epiphysis, this is the distal epiphysis. Actually, this bone is the femur. Okay? And then if you see here, in the upper part of this diaphysis, we have a nutrient artery. This is a blood vessel that is going to provide blood supply to the bone and enters here into the nutrient foramen. So then in here, in this epiphysis, you can see this pad of cartilage. This is the articular cartilage, the one that protects these endings from eroding. And this bone is protected by the periosteum, this membrane. And then you have collagen fibers, which are the perforating fibers, or Charpais, that attaches this membrane into the bone. So here they remove this membrane so that you can see how you have blood supply given by these nutrient arteries underneath the periosteum. And it's not labeled in here, but this region between the epiphysis and the diaphysis is known as metaphysis. So this is the metaphysis in between the epiphysis and the diaphysis. Now, if you make a longitudinal section or a section along the length of the bone, you can see the internal parts. So internally here in the epiphysis, you have a spongy bone, which is a type of bone in which the cells, the osteocytes, are scattered apart. They're not as close by as the compact bone osteocytes. And then you have a lot of connective tissue that is called the trabeculae. So at least in this epiphysis, you have red bone marrow, meaning that you are producing blood cells, hemopoiesis. Now, in this distal epiphysis, you have a spongy bone, but you don't see the bone marrow, the red bone marrow. So you are not producing blood cells in here, but you are producing it in here. So this is actually an adult bone. And how can I tell? Well, because in this medullary cavity, instead of having red bone marrow, we have yellow bone marrow. So this is connective tissue. This is adipose tissue. This is fat. As we age, our bones in the medullary cavity in the marrow stops producing blood cells. They start storing fat. But you still have some areas of the bone, like in this case, the proximal epiphysis, where you produce bone cells. This is the red bone marrow. And now, this covering internally in the medullary cavity is called the endosteum. And then in here, you have the distal epiphysis, and this line is the epiphyseal line. So if you had a pad of cartilage, you can tell that it is a bone from a young person. But no, it's from an adult because of two reasons. First, it has the yellow marrow here, and second, you have an epiphyseal line rather than an epiphyseal plate. So that's how can you tell, you can tell that this is an adult bone. Any questions? So now let's look at the differences between the microscopic structure of spongy, which is also known as cancellous bone, and compact bone. So in compact bone, you have units of bone that we call osteons. In these osteons, in the middle, you have a central canal. And in this central canal, you have an artery, which is the central artery, that is a branch of the nutrient artery. And it runs through this nutrient canal to provide blood supply, which is rich in oxygen nutrients, to the surrounding cells and the surrounding tissue. So you have around the central canal concentric layers of bone that we call the concentric lamellae. And within these concentric lamellae, we have the spaces where we keep the cells of the bone. So the lacuna, which means little lake, or lake in Spanish or Latin, that's the space where you have the osteocytes. And then the central canal in compact bone is also known as Haversian canal. And then within this concentric lamellae, that's where you have the lacunae. Lacunae is for plural. Lacuna is one, lacunae is multiple lacuna. And then you also have the tiny spaces, which is called canaliculi, through which the cytoplasmic extensions of the osteocytes travel, so that you can have different osteocytes sharing nutrients, sharing signals, so that they can form a strong bone. So that's the structure of compact bone. Now for cancellous bone or spongy, you have still osteocytes, but you don't have osteons, but you have lacunae. And then the trabeculae, which are irregular shaped structures, not as round as the osteocytes, the osteons. The osteons are round. The trabecula are a little bit oval. So it's in this trabecula where you have the lamellae. The lamellae is like, in the case for the compact bone, is like onion rings around the center of the bone. And then both of them, no matter if it's a spongy or if it's compact, they provide a structural support and strength to our bones. So here is the view of bone tissue, microscopic view. So if you magnify the diaphysis of a long bone, you can see here this area. This is the endosteum, this is the periosteum, and this is the nutrient artery entering through this nutrient foramina, going through these perforating canals or Volkmann canals, and then after it goes deeper from periosteum into endosteum, they take this route to go into these central canals. But not only you will have an artery, you will also have a vein and a nerve, as you can see. So the vein will be in blue color, the artery in red, and the nerve in yellow color. All these three structures goes through this canal. And then these are the osteons. So this is telescope osteons. This is like a longitudinal and cross-sectional view of the bone. So this is the medullary cavity, the endosteum. Then this is the compact bone, this is the periosteum. So the compact bone is sandwiched between both the endosteum and the periosteum. And then you have the artery running and the vein running here, and also the nerves. And then if you telescope all of these osteons, and then you telescope them more, you can see the concentric lamellae. So these are the concentric lamellae. So if you magnify it, this is the concentric lamellae. These lines that you see here represents the collagen fibers, the orientation. These collagen fibers runs in this direction, this in this direction, this in another direction. Are they randomly oriented? No. I mean, why is this way? Well, because the bone receives forces in multiple directions. So this is to accommodate the different physical forces. Okay, as we walk, as we carry objects, so you have to have flexibility in different directions with these collagen fibers. And then here we have canaliculi. And this is the lacunae where you keep the osteocytes. So this is a cartoon. Now, this is light microscopy view of the osteons. So this is like making this section. Like you have it like this, you make a cross section like this, and then you see it this way. Okay, so now what you can see there, it is the central canal or traversing canal, and this will be the concentric lamellae. These are the lacunae, and there inside you have the osteocytes. And these little lines that you see there will be the canaliculi, the space where the cytoplasmic extensions of the osteocytes goes or uses to go through. Now for a spongy bone or cancellous bone. So now if you look, this is one of the epiphyses. So you have compact bone outside and you have spongy bone in the middle. And if you magnify a piece of spongy bone, you can see these struts or trabeculae. So they don't have a round shape as this. So these osteons have a round shape, but the trabeculae, they are irregular in shape. So if you magnify these trabeculae, you can see the different parts. So this external part is the endosteum, and you have osteoblast. And then you have osteoclast as well. And then in here, you have lacunae with the osteocytes, and then you have canaliculi. So this is a light microscopy view of this cancellous bone. So here is the bone itself. This is the endosteum. This is an osteoblast. Inside the bone, you have the mature cells, which are the osteocytes. So the osteocytes, they have this star shape with these cytoplasmic extensions. And the osteoclasts are gigantic cells with multiple nuclei. Any questions? Now for flat bones are made by two thin layers of compact bone, sandwiching a middle layer of spongy bone that we call diploe. This diploe has red bone marrow. So where do we have flat bones? In our skull, for instance. We also have it in the sternum, and we also have the coxal bones. We have this type of tissue. Think about it this way. When it comes to the ribs are considered long bones. When it comes to doing an open heart surgery, well, the heart is toward the left in the thorax, right? And then doctors cut the sternum in half, and then they open up to reach to the heart. Why they don't cut the ribs? Well, it's not only for alignment, because you have to cut multiple ribs, and to align them is going to be harder than to align a single bone. But the sternum, since it's a flat bone, what it has a lot of this tissue, a spongy tissue in the middle, which make it to heal faster than in this side. Okay, so that's why they do it that way. So we will leave it up to here. We saw already the histology of all these types of bone. So any questions?